Health experts say don't panic over Omicron. Scientists expect more information on the variant in the coming days and weeks.
But for now, is there a way to tell the difference between the initial strain of COVID-19, the Delta variant, and Omicron besides testing? Sarah Hammond has the answer.
As we head into the holiday season, the new Omicron COVID-19 variant could cause some major problems. Dr. Anthony Fauci said it was just a matter of time before the variant made its way to the U.S., and now it has.
There's been no evidence yet that this variant is more dangerous than other variants that we've seen. So it's not a time to panic, but it is a time to prepare.
Dr. Rebecca Sensenig, an infectious disease specialist with Riverside Health System, says scientists are still gathering information on this new variant.
We're really going to get a lot more data over the next couple weeks.
But for now, if you're not feeling well, can you tell the difference between the original strain, the Delta variant, and the Omicron variant?
So symptoms of Omicron, from what we know so far, which is again very limited, they seem to be very similar to the Delta, Alpha, all the other variants that we've seen.
But she says right now there is one exception.
The exceptions that we've heard from some of the physicians in South Africa are that the Omicron variant is not causing loss of sense of taste or smell as frequently, but the other symptoms, cough, myalgias, the other typical COVID symptoms, they are still seen.
Sensenig says the only surefire way to tell the difference between the strains is through testing.
We have to be able to genetically sequence the variant to see what mutations they have, and that tells us which variant it is.
Dr. Sensenig says the good news is the majority of cases coming out of South Africa have been mild, and she says in the coming days and weeks, we need to use those mitigation strategies that we know work: wearing a mask, washing your hands, practicing social distancing, and getting vaccinated. For 13 News Now, I'm Sarah Hammond.
Dr. Sensenig says as of now, the vaccines appear to work against the new variant.
She says they are still our best form of protection.